WHO chief scientists. We have Mr. Derek Walton, who is our legal counsel. We also have Dr. Mike Ryan, the Executive Director of Health Emergency Program. And we have Mariangela Shimao, who is Assistant Director General for Access to Medicine. We also have a special guest that Dr. Tedros will introduce in a second. And before I give the floor to Dr. Tedros, just to remind you that we will have simultaneous interpretation in 6 UN languages plus Portuguese and Hindi. I would like to thank our interpreters who are here with us. Once we start question and answer session, you can ask questions in those languages. With this, I'll give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening. In the past few days, there have been reports of new variants of the COVID-19 virus in South Africa and the United Kingdom. Viruses mutate over time. That's natural and expected. The UK has reported that this new variant transmits more easily, but there is no evidence so far that it's more likely to cause severe disease or mortality. WHO is working with scientists to understand how these generic changes affect how the virus behaves. The bottom line is that we need to suppress transmission of all SARS-CoV-2 viruses as quickly as we can. The more we allow it to spread, the more opportunity it has to change. I cannot stress enough to all governments and all people how important it is to take the necessary precautions to limit transmission. This year has been difficult for all of us, but for health workers, it has never been harder. At this festive time of year, for so many, the best gift for health workers is for leaders and citizens to take precautions that ease the pressure on health systems. Safe and effective vaccines give us hope, but they're not an excuse for people to let down their guard and put themselves and their loved ones at risk. Now is the time to double down on the public health basics that have seen many countries suppress the virus effectively. There are a number of groups that continue to push a narrative that this virus only affects the old and that with vaccines on the horizon, we can relax. COVID-19 affects children and adults in a variety of ways, and it can attack every system in the body. And a growing number of people suffer with long-term consequences of the virus. This includes neurological complications for children and adults, which are still being researched. Vaccines are offering hope for some, but I'm deeply concerned that vaccine nationalism will deprive the world's poorest and most vulnerable people of these life-saving tools. Now is the time for political commitment to be translated into action. Pledges and promises will not protect anyone unless they are realized. Last week, we announced that the COVAX facility, which is backed by 190 countries and economies, has secured access to nearly 2 billion doses of promising vaccine candidates. In the early 2021, $4.6 billion in additional funding will be needed to purchase COVID-19 vaccines for at least 20% of the population of all low and lower middle-income countries. This will ensure health workers and those at highest risk of severe disease are vaccinated, which is the fastest way to stabilize health systems and economies and stimulate a truly global recovery. The 100-100 initiative of WHO, UNICEF, and the World Bank aims to support 100 countries to conduct rapid readiness assessments and develop country-specific plans within 100 days for vaccines and other COVID-19 tools. 89 countries have already completed the assessments, and our teams are working around the clock to ensure that governments and health systems are ready for global vaccine rollout. WHO has also released a new training course for health workers on COVID-19 vaccination, which is available at openwho.org. Vaccines will help to end the pandemic, but the effects of COVID-19 will continue to be felt for many years to come. The pandemic has exploited and exacerbated the vulnerabilities and inequalities of our world, but it has also shown that in the face of an unprecedented crisis, we can come together in new ways to confront it. Every crisis is an opportunity to question the way we do things and to find new ways of doing them. For 30 years, our colleagues at the United Nations Development Programme, or UNDP, have published a Human Development Report, an annual snapshot of the state of global development. UNDP has long been a critical partner to WHO, working closely on a host of health and development issues together to solve problems on the ground so that people get the services they need. The latest edition of the Human Development Report, published last week, takes an in-depth look at the COVID-19 pandemic and what it might mean for the future of development and humanity. To talk more about the report, I'm pleased to be joined by my brother, Achim Steiner, the administrator of UNDP. Achim, thank you for your partnership and thank you so much for joining us today. The floor is yours.
Thank you very much, dear Tedros. Thank you to the very kind invitation to join you for today's briefing, another very sobering and dramatic point in this pandemic. And it is an honor to be part of this press conference today to mark the launch of what you just referred to, the 2020 Human Development Report. These unprecedented times require us to come together to seek solutions to our shared problems, and that includes us as UN agencies. COVID-19 is a dramatic health crisis, and we are just being reminded of it again in the words that you have shared with us. But we also come together today because it has triggered a social and economic, a development crisis that we have not seen in our lifetimes. Not only has the virus taken the lives of more than 1.6 million people, it has destroyed livelihoods, crippled health systems, locked hundreds of millions of children out of classrooms, and is costing the world's economy more than $9 trillion over 2 years, according to the IMF, and the equivalent of up to 400 million jobs, according to our sister agency, the ILO. UNDP projects that for the first time in 30 years, global human development progress is going backwards. UNDP has calculated that by the end of the decade, 1 billion people could be living in extreme poverty. A quarter of those, 250 million, could be people pushed into poverty as a consequence of the pandemic. As the Human Development Report makes clear, COVID-19 is the latest in a string of consequences resulting from the ever-growing pressures we put on the planet in the name of progress. This is the reality of the Anthropocene, the age of humans, as we refer to it, and in it, humanity is, in a certain way, waging a war against itself. For 30 years, UNDP has released the Human Development Index, ranking countries in the world by how they expand people's freedom and opportunities, by measuring health, education, and income. But this year, we decided that we needed to try something new and long overdue. We included an experimental index to gauge human progress by accounting for per capita national carbon dioxide emissions and per capita material footprint. The result shows that no country is successful in advancing humanity without extracting a heavy toll on nature and our planet. Yes, there are countries successful in a lighter planetary imprint, and yes, there are countries with prosperous populations, but not one nation is doing both. Achieving this balance is the next frontier of human development, as the report is called. And as it sets out, very critically also, inequality is central and is a barrier to that mission. Because inequality is both a cause and a consequence of planetary imbalances, and it stands in the way of solutions. While the pandemic has undoubtedly touched us all, its impact is being felt differently depending on who you are, where you live, and how much money or power you have. Existing and growing inequalities have meant that around the world, those that already have the least have been hurt the most. And in its simplest, we have all realized that it is extremely expensive to be poor in a pandemic, whether you are a household or a country. Poor people, women, marginalized people, day laborers, and those in unstable employment or in the informal sector have all faced disproportionate hardship. For instance, evidence from a number of countries also indicates that the pandemic is erasing decades of progress in women's labor force participation. But the report is very much focused on also stating that it doesn't have to be this way. The first test of our willingness to transform will be the delivery, as Dr. Tedros just referred to, of COVID-19 vaccines to the world's population. The COVID-19 pandemic is exposing and exacerbating fragmentation and long-standing gaps in public health and deepening chronic inequities. The delivery of the COVID-19 vaccine must be equitable. Otherwise, we risk entrenching the very inequalities which are harming the health of people and the health of the planet and are going to give rise to more social and economic tensions. Without delivery of COVID vaccines that are equitable, efficient, and trusted, we will undermine the recovery from COVID-19 and not only lose even more lives, we have to be reminded that none of us is safe unless we are all safe. The scientists who have brought us effective COVID-19 vaccine candidates in record time have shown what is possible through collaboration and innovation. We must now be equally bold in taking the baton to deliver the vaccine to the people of all high, middle, and low income and least developing countries. This is the ultimate stress for planetary health, delivering the largest public health intervention of a lifetime and driving in a concurrent way the recovery in an inclusive and green direction. An undertaking of this magnitude, and I envy this, requires us all to work together in unprecedented ways. UNDP is privileged and continues to be committed to playing its part in the whole UN family system response, but guided in particular also by WHO's leadership while working in partnership with our sister agencies, Gavi, the Global Fund, and others through the ACT Accelerator, the SDG 3 Global Action Plan, and beyond. Thank you so much, Tedros, for inviting me to join you today, because together with the world's people, we can defeat this virus and most importantly, come out of this deep, dark valley that the world finds itself in right now. And part of that story will be a different development pathway into the future. And that's what the Human Development Report 2020 has tried to address itself to. Back to you. Thank you.
Thank you, Hakim. And I hope you will stay with us to respond to questions from journalists who have joined today. And Tariq, back to you.
Thank you very much, Dr. Tedros, and thank you, Mr. Steiner, for this very